Hi everyone, this is Nurse Anna from nursestudy.net. Today we are starting our case study series. Today we are going to do a case study on pneumonia. And don't forget we have study guides and free audiobooks available in our store. The links are in the description below. Section 1. Patient snapshot. Patient MR. Age 68 years old. Chief complaint, shortness of breath, productive cough with yellow-green sputum, and fever for 3 days. Past medical history, hypertension, type 2 diabetes, mellitus, and smoking history of 1/2 pack per day for 30 years. Current medications, metformin 500 milligrams twice a day, lisinopril 10 milligrams daily. Social lifestyle, retired factory worker, single, smokes 1/2 pack per day, minimal exercise. Why it matters: chronic conditions like diabetes and smoking weaken the immune system and slow lung healing. This increases the risk of infections such as pneumonia, which causes inflammation and fluid buildup in the lungs. Section 2. Presenting assessment. Vital signs. Temperature 101.9 degrees Fahrenheit, 38.8 degrees Celsius. Heart rate 108 beats per minute. Respiratory rate 26 breaths per minute. Blood pressure 138 over 82 millimeters of mercury. Oxygen saturation 89%, room air. Physical assessment: crackles and diminished breath sounds in right lower lobe. Thick yellow sputum. Fatigue, mild confusion, flushed skin. Subjective data: it's hard to catch my breath and I feel so tired. Initial tests: CBC, chest x-ray, sputum culture, basic metabolic panel, pulse oximetry. Which cues show impaired oxygenation? Which cues show infection? Which cues show impaired oxygenation? Oxygen saturation 89%, tachypnea, crackles, and shortness of breath. Which cues show infection? Fever, purulent sputum. Section 3. Pathophysiology. Normal function. The lungs bring oxygen into the blood and remove carbon dioxide. Air travels through the bronchi into small air sacs called alveoli, where gas exchange occurs. What's going wrong? In pneumonia, bacteria, viruses, or fungi infect the alveoli. The body reacts by sending immune cells to fight the infection. This causes inflammation and fluid buildup in the alveoli. Why this causes symptoms: fluid and pus in the alveoli make it hard for oxygen to pass into the blood, leading to low oxygen levels, shortness of breath, low O2 saturation. The body raises temperature to fight infection, fever. The cough produces sputum as the body tries to clear mucus and debris. Section 4. Unfolding update. New data: chest x-ray, right lower lobe consolidation consistent with pneumonia. CBC, WBC count 15,500 per cubic millimeter elevated. Sputum culture, pending results. Oxygen saturation now 91% on 2 liters nasal cannula. Symptoms: continues to have productive cough and fatigue but feels slightly better after oxygen. Questions: what finding confirms the diagnosis of pneumonia? Answer: chest x-ray showing right lower lobe consolidation. What is the priority action for the nurse? Answer: maintain oxygen therapy per facility protocol and monitor respiratory status. Section 5. Nursing diagnosis and prioritization. 1. Ineffective airway clearance, related to excessive mucus and inflammation, as evidenced by productive cough, crackles, and low oxygen saturation. 2. Risk for infection, spread or worsening, related to inflammatory process and presence of pathogens, as evidenced by elevated white blood cell count and fever. Prioritization question: which diagnosis is most important now? Answer: ineffective airway clearance, because maintaining oxygenation is the immediate priority for life support. Section 6. Nursing care plan. Priority diagnosis 1. Ineffective airway clearance. Short-term goal: patient will maintain oxygen saturation greater than or equal to 92% within 24 hours. Long-term goal: Lungs will clear with normal breath sounds and minimal cough within 5 days. Interventions: administer oxygen per facility protocol, improves oxygen levels. Encourage coughing and deep breathing every 2 hours, helps move secretions. Position in semi-Fowler's position, promotes lung expansion and comfort. Provide fluids as tolerated, thins secretions for easier clearance. Monitor oxygen saturation and lung sounds every shift, assesses improvement. Priority diagnosis 2. Risk for infection, spread or worsening. Short-term goal: body temperature will remain under 100.4 degrees Fahrenheit within 48 hours. Long-term goal: WBC count will return to normal and infection will resolve by discharge. Interventions: administer prescribed antibiotics on time, kills infection-causing bacteria. Monitor vital signs and WBC count trends, tracks infection response. Encourage rest and adequate nutrition, supports immune function. Perform hand hygiene before and after patient care, prevents spread. Educate patient about completing all antibiotics as prescribed, prevents relapse. Section 7. Complication scenario. New data. After 12 hours, the nurse finds MR more short of breath. Vital signs: respiratory rate 32 per minute. Oxygen saturation 85% on 2 liters nasal cannula. Heart rate 120 beats per minute. Patient is using accessory muscles and appears anxious. Question: what is the nurse's first action? Answer: apply oxygen per facility protocol and increase monitoring frequency. Provider response: the provider is notified immediately. Orders received: increase oxygen flow, draw arterial blood gas, ABG, and start IV antibiotics. Oxygen saturation improves to 94% after adjustments. MR reports easier breathing. Outcome: patient stabilizes with improved oxygenation and reduced respiratory distress. Section 8. Patient education and discharge teaching. Take all antibiotics exactly as prescribed. Do not stop early. Rest and drink plenty of fluids to help loosen secretions. Avoid smoking and exposure to secondhand smoke. Eat balanced meals with lean protein, fruits, and vegetables to support healing. Continue deep breathing and coughing exercises several times a day. Follow up with your healthcare provider within 1 week. Seek medical help right away if you develop worsening shortness of breath, chest pain, or high fever. Get an annual flu shot and pneumonia vaccine as recommended. Section 9. Evaluation and reflection. What early signs showed the patient's condition was worsening? Answer: increased respiratory rate, low oxygen saturation, and anxious appearance. What would you monitor more closely next time? Answer: airway and oxygen levels, especially early signs of fatigue or restlessness. What teaching could prevent recurrence? Answer: smoking cessation, vaccination, and prompt reporting of respiratory symptoms. Question 1. A 68-year-old client with right lower lobe pneumonia has the following data: temperature 102.2 degrees Fahrenheit, 39 degrees Celsius, respiratory rate 28 per minute, heart rate 110 per minute, blood pressure 136 over 84 millimeters of mercury, oxygen saturation 88% on room air. Crackles and diminished breath sounds in the right lower lobe. Productive cough with thick yellow sputum. Which assessment finding is the highest priority for the nurse to address first? A. Fever of 102.2 degrees Fahrenheit, 39 degrees Celsius. B. Heart rate of 110 per minute. C. Oxygen saturation of 88%. D. Thick yellow sputum. Correct answer: C. Oxygen saturation of 88%. Rationale: oxygen saturation of 88% shows impaired gas exchange and decreased oxygen delivery to tissues. This is an airway/breathing problem and is the top priority using the ABCs. Fever and tachycardia are important, but can be treated after oxygenation is supported. Thick sputum is expected in pneumonia and will be managed with ongoing interventions, but low oxygen is more urgent. Question 2. The nurse admits a client with community-acquired pneumonia who is short of breath and anxious. The client's oxygen saturation is 86% on room air, respiratory rate is 32 per minute, and the client can only speak 2 to 3 words at a time. Which action should the nurse take first? A. Obtain a sputum culture. B. Apply oxygen per facility protocol. C. Administer IV antibiotics. D. Notify the provider of abnormal vital signs. Correct answer, B. Apply oxygen per facility protocol. Rationale. The client has signs of acute respiratory distress, tachypnea, low saturation, difficulty speaking, so supporting oxygenation is the immediate life-saving action. Sputum cultures and antibiotics are essential for treating infection, but must not delay stabilizing breathing. The provider should be notified, but after the nurse takes an initial stabilizing action to improve oxygenation. Question 3. A client with bacterial pneumonia started IV antibiotics 24 hours ago. Which finding shows that the treatment is most effective? A. Decreased white blood cell count and afebrile. B. Increased productive cough with thick sputum. C. Lung sounds with persistent crackles in the affected lobe. D. Fatigue when walking from bed to chair. Correct answer, A. Decreased white blood cell count and a febrile. Rationale. A lower white blood cell count and normalization of temperature indicate the infection is being controlled, which is the main goal of antibiotic therapy. More productive cough can occur as secretions mobilize but does not directly prove infection is resolving. Persistent crackles and fatigue can linger even as infection improves and are not the best indicators of treatment success. Question 4. A client with pneumonia who was previously stable now has new findings. Respiratory rate 34 per minute. Oxygen saturation 84% on 2 liters nasal cannula. Use of accessory muscles. Restless and confused. Which complication is the nurse most concerned about? A. Atelectasis. B. Impaired gas exchange leading to respiratory failure. C. Dehydration from fever. D. Medication side effects. Correct answer, B. Impaired gas exchange leading to respiratory failure. Rationale. Very low oxygen saturation, despite oxygen, tachypnea, accessory muscle use, restlessness, and confusion are classic signs of worsening gas exchange and impending respiratory failure. Atelectasis can occur in pneumonia, but the current signs point to systemic hypoxia, which is more urgent. Dehydration and side effects are possible, but do not explain the acute respiratory changes as clearly as impaired gas exchange. Question 5. The nurse is preparing discharge teaching for an older adult recovering from pneumonia. Which statement by the client shows a need for further teaching? A. I will finish all of my antibiotics even if I feel better. B. I should call my provider if my breathing gets worse again. C. I can start smoking again once my lungs feel normal. D. I need to get my flu and pneumonia vaccines as recommended. Correct answer, C. I can start smoking again once my lungs feel normal. Rationale. Smoking irritates the airways, impairs ciliary function, and increases the risk of another pneumonia episode, so restarting smoking is unsafe. Finishing antibiotics, seeking help for worsening breathing, and receiving vaccines are all correct and help prevent recurrence and complications. I hope this helped you understand the pathophysiology and nursing care for pneumonia. Visit nursestudy.net for study guides, care plans, and NCLEX practice questions. Keep studying smart, and I'll see you in the next lesson.